Good evening, everybody. This is Dr. Kurt Wooler, and I appreciate you joining me again tonight for another Great Plains Laboratory-sponsored webinar. Tonight, we're going to talk about heavy metal testing, and also, along with testing, we're going to talk about some different options for detoxification intervention with respect to heavy metals. So let's get started. So the premise of this presentation is not only to give you an outline of what are some available tests for heavy metals, but to go through some of the traditional therapy. We'll have a discussion with respect to some alternative approaches. You know, like anything in biomedical intervention, it's difficult to cover every topic in a real in-depth way with just one particular lecture. So I hope you come away from this at least armed with some additional information if you're considering this for your child, or if you're a practitioner out there looking to implement heavy metal therapy or intervention for any of your patients, really. And one thing with respects to heavy metal detox, and really try to, I think, diminish some of the controversy, the word or the catchword that is often used for this particular approach called chelation therapy is not something that I commonly use. And let me get rid of this screen real quick. Because in reality, treating for lead or treating for mercury or treating for arsenic, whether it's a child in the autism spectrum, an individual with cancer, somebody with diabetes, heart disease, somebody with depression, these are not specific treatments for that particular diagnosis. Really, the approach for removing heavy metals from any patient population is to improve their health, because as you'll see, the presence of heavy metals, lead, arsenic, mercury, etc., are toxins, and so they're not healthy really at any levels. So I don't particularly implement chelation therapy, or what really is more appropriately called heavy metal detoxification therapy, as a specific treatment for autism. I implement that intervention to help remove high levels of toxic metals in kids who have a diagnosis of autism, and really in attempts to improve their overall health, including not only their physical health, but their cognitive health, language, behavior, social issues. And so that's the goal of this. And it really is not, or doesn't have to be, a controversial or viewed as a controversial therapy. It's a very appropriate therapy for somebody who has heavy metal toxins. I mean, that the reality is, if you're exposed and you're accumulating and you're storing high levels of lead in the body, well, the only appropriate treatment for that is heavy metal detox therapy. There really isn't another therapy. It certainly isn't appropriate to just do nothing and leave it alone. So that's the approach that I take, and I think it's an overall approach that I think many practitioners feel more comfortable with. So with that said, in this presentation, we're going to talk about some examples of heavy metal poisons and their impact on general health. We'll try and define metal toxicity. We'll talk about something called a provocative challenge, and really, is it necessary? And then we'll get into some additional information on traditional therapy. As I mentioned, we'll have a discussion on various alternative options, and then some supportive therapy before we wrap things up. Okay, so let's talk about some examples of health consequences of heavy metal poisons. And I want to thank Dr. Bill Shaw from Great Plains in donating some slides for this presentation. Some of these slides are actually from a larger presentation that he does on the consequences of heavy metal toxicity and from various metals, as well as discussions with respect to some testing. So what are some different types of tests? Well, it turns out that hair testing is really considered to be best for chronic long-term exposure. And that's been my experience over the years in working with many different patient populations, and certainly with kids on the autism spectrum, that the hair test gives a really good representation of exposure, particularly past exposure and the accumulation of metals over time. And the analogy would be made, for those of you who are not clinicians, there's a blood test for diabetics called hemoglobin A1C. Blood glucose is a good measurement for acute situations or what's called clinical emergencies with respect to a diabetic condition. However, in order to measure the maintenance of proper glucose or blood glucose over time, there's a test called a hemoglobin A1C, which is actually more accurate. And so a lot of doctors who work with diabetics will use hemoglobin A1C as a way to see if the diabetic is actually controlling their blood sugar on a day-to-day, week-to-week, and month-to-month basis. Now, it turns out that blood and urine are good tests for toxic exposures from an acute situation, but really hair testing is much preferred from a chronic standpoint. And then there's, the comment that, chelation challenge, whether you use, and I'll talk about that here shortly, actually is comparable to hair testing, and actually it is. It's pretty good representation, and that's why I think hair testing is preferred in many cases, because it's inexpensive to do, it's easy to obtain, and the reality is it shows good data. So the following slides after this particular one are from different samples from the same child. In this particular slide here, we have a whole blood analysis. So this is a blood analysis for heavy metals. And you'll notice that lead, mercury, and nickel all show up in the normal range, or what would be considered the normal range, less than the 95th percentile. So most doctors would look at this and say, okay, there's been some exposure, but these are not toxic levels per se. Now this is the same child looking at different tests. This is actually mercury levels showing up extremely high on a hair analysis, whereas before mercury was in the normal range. And then looking at the urine sample in the same child, where the mercury levels are now normal. Now some might argue that the mercury levels are high normal, and that certainly could be the case, but it's not as high as what's in the hair. And this comes up quite a bit. Many times the blood levels are not indicative of chronic exposure, and so they're really good for more recent acute exposure. And the same with urine. After you've been exposed and stored these things in the body for a while, they're not spilling or circulating in the blood or spilling in the urine to any significant degree. Now, it would have been nice in this particular scenario to have done a challenge test where they actually give something like DMSA or DMPS at a high dose to see what would have come out. Very likely, we would have seen the mercury level much higher. All right, so heavy metals, we're all exposed. And the differentiating point between one individual and the next is not only their level of exposure, their ongoing rate of exposure, but how well they're able to detoxify those metals out of the body. And we know that for many kids on the spectrum, they have poor detoxification systems. And so they're going to be more apt to store heavy metals in the body. Mercury comes in many forms. We know it can come through vaccines, particularly in the past through the thimerosal preservative that was in vaccines for many years. Fish is a major source of exposure to mercury, as well in the United States anyway. Dental fillings are still a major source of mercury exposure. Lead, mostly in paint, not so much in the U.S. anymore, but certainly in other places in the world. As a gas additive, again, not so much in the U.S., but certainly around the country, and it can be found in plumbing as well. Cadmium is commonly found in secondhand smoke or even direct smoke of cigarettes. Can be found in shellfish and tires. Arsenic, commonly found as an herbicide and pesticide, definitely found in seafood and even chicken. So in areas where chicken consumption is quite high, it's very likely arsenic levels will be as well. And I'll show you some slides here of some hair tests that I have of kids out of China that show very high levels of arsenic. Copper is one of these kind of metals that is complicating within autism because some kids are extremely high in copper, and it can act as a central nervous system irritant, much like lead and mercury can. And common sources would be drinking water, copper pipes in the home, etc. Aluminum is actually found in many vaccines. They use it what's called an adjuvant, which means that it helps to increase or stimulate the immune system to produce antibodies. It's also found in a lot of other, food products, etc. And antimony you'll commonly find high on a hair analysis, primarily because it's used as a flame retardant in children's pajamas. Well, let's give an example and just talk about a quick example here of one particular heavy metal which has been well researched not only in the integrative medicine world but in the traditional medical world, and that's lead. Now, lead can be found in a wide variety of populations. Here in the U.S., it was commonly in paint, and up until about 1982, paint in the U.S. actually had lead. And so, certain homes that were painted with that lead is certainly an ongoing source of lead exposure for many people. Fortunately, that's sort of, in most areas, not a big problem anymore. And the reality is all lead, or really all levels of lead exposure, are harmful. There is no known safe level of lead. And so it's really just a harmful heavy metal at any level. And clearly there's been research in the past and discussions within the media in the past with respects to lead exposure for kids, particularly lead in the home. Now, there's research dating back many, many years, and this is just one particular example of a research article that came out back in 1994 that looked at lead exposure in school-age children who are having attention problems. And what they did is they took 43 boys aged 8 to 12 years of age, and they tested their hair. And what they found, and why this is important, is there's many people, or many doctors anyway, many times in the traditional medical community that say a hair test is irrelevant, it doesn't have any meaning, and it's not useful. Well, that's completely untrue. And what they did in these kids is they looked at their hair, and they looked at the levels of lead in their hair. And you would sort of surmise here that the kids who had the highest level of lead in their hair generally had more behavioral issues, less flexible, and less ability to focus or attend to task. And then there additional research in '96 where this particular study, and this was out of the University of Massachusetts, and what they did is they looked at 277 hair samples from first graders, and they noticed a striking relationship between the levels of lead and negative teacher ratings. And they noticed an even stronger relationship between physician-diagnosed attention deficit disorder and hair lead. And also one thing they noted in this study was there was no apparent safe threshold for lead exposure. And this is just a graph that kind of breaks down the teacher ratings of students with respects to hyperactivity. As you can see here at the bottom, parts per million hair lead content. As the lead levels went up, the teacher ratings of hyperactivity went up. And then as a follow-up to that, their overall function in class, meaning attending to task, focusing, etc., got worse as the hair lead levels got higher. Now, it's interesting if you look at studies with respects to lead levels in the blood. And this is just a graph that kind of highlights this. If you go back to the 1960s, the CDC is the Center for Disease Control. And back in the 60s, they were saying, if you got a blood level of 60, micrograms per deciliter, you're doing pretty good. Okay, so not a big deal. Then, about 13 years later, they look at level levels and say, okay, well, we've kind of decided it's now down to 40. So if you're at 40 or above, it's a problem. Any less than that, not so much. Well, 2 years later, it's down to 30, then down to 25, and it just ratchets down there. The last time they really looked at that was in 2006. They took it from, what is that? So 46 years, they took it from 60 to 2. And so this shows you really that even within these governmental agencies, the CDC, The World Health Organization, the Environmental Protection Agency, they keep saying we got to keep lowering these levels of lead because these levels obviously were problematic. And then finally, this is just another graph here showing reading comprehension, what would be considered reading deficits in U.S. children. Down here is the level of lead, and so the bottom graph, and on the upward side of this graph is reading comprehension percentages. So as the levels are less than 2.5, we get higher reading comprehension and capabilities, and as the levels get higher of lead, then we see a reduction in reading comprehension and increase in reading issues. Additional research, talks about the effect of lead in autism, and this is just one sample of an article that came out in 1996 that looked at attention deficit disorder, infantile autism, and elevated blood lead, not hair lead, but blood lead levels. And what they did in this particular child, they noted in this case report, was the child was treated with DMSA, so a typical chelating agent. And what they noticed was a decrease in repetitive behaviors while he was on the chelation treatment, and a decrease in, or I guess you could say, an increase in the repetitive behavior when that medication was stopped. Well, it's not only lead, but it's mercury too. And we know that mercury is a big problem worldwide, and we certainly know mercury is a huge problem in neurological disorders. This is just an image of an individual from many years ago who was mercury poisoned from consuming fish in an area in Japan that had been contaminated with mercury. And this occurred in what was called the Minamata area of Japan. And what it was there was a total of 191 fishermen, as well as their family, ranging anywhere, usually in the from 30s to 80 years of age, that were living in an area that was polluted with, actually came from a paper mill, a paper treatment facility that was dumping their pollutants into the water. And it caused toxicity within the fish. These families and these fishermen ate these fish, and they developed severe neurological and health consequences secondary to the mercury toxicity. And this is a very famous case with respect, or famous situation with respect to environmental mercury toxicity. And what they found was the vast majority of these people had severe neurological symptoms, sensory distribution issues at very, very high rates. Well, as we transition into the discussion with respect to autism, we know that the issue with mercury toxicity has been hotly debated for years with respect to autism, and it clearly shows up for many kids. This is just a sample of a hair analysis of a 5-year-old child with autism. And we can see here, now that we know the information with respect to lead, look how high the lead is. The mercury is almost just as high. So this is a child that has been accumulating, because we know that hair tests are representative of chronic long-term exposure. This is a child that has been exposed, over time and is accumulating those very likely in the body at high amounts. And then a follow-up to that is another child with PDD, very high levels of lead found on the hair test. And one important thing here for all the parents out there, with your kids, it's not just your kids that have likely been exposed, but it's possible that you may have been exposed as well. And so, one of the things that I recommend, if it's doable, is for parents to, test themselves, even just doing a hair test, or even just doing a hair test on the family to see what it is you're being exposed to environmentally, just to get a better idea of, the accumulation of some of these heavy metals. And this is just coming from a mom with a child on the autism spectrum. All right, so let's shift gears here and now try and define, if we can, heavy metal toxicity, specifically with respect to various testing. The reality is that there's not a 100% foolproof way of absolutely defining toxicity from heavy metals. We can certainly get an indication of exposure. We can get an indication of how high something is on a test, but you always have to apply each individual test to the individual person. So somebody who might have high mercury levels on a hair test may have a lot of severe neurological problems, but somebody else may not. So each test really needs to be applied clinically to each person. So really what we do in many cases is when we find high levels of heavy metals is we implement detoxification therapy really because it makes clinical sense to do so. I mean, the reality is if you did a blood test and found iron levels to be low, or you found vitamin D levels to be low, but you had an individual who wasn't really impaired, or at least outwardly impaired. Let's say iron levels, they weren't manifesting with memory problems or fatigue or sleeping deficits, but it's still good medicine to give them iron to supplement for that deficiency. Same thing can be said with heavy metals. Just because you find heavy metals high in the individual, but they're not necessarily having a lot of obvious outward neurological problems, to me anyway, it doesn't make sense to just leave it alone, because essentially that metal is really not going anywhere. So a lot of times what we do is implement detoxification therapy because it makes clinical sense to do so. And in many cases, people improve. And certainly if they've had a lot of health consequences, they can get better. Now, there is a particular test that Great Plains carries that it's interesting test from the standpoint that it does give a little bit more insight into the potential toxicity effect of heavy metals at the cellular level, as opposed to, let's say, a hair test that gives an indication of chronic exposure. A blood test may give more recent exposure. A urine test would be indicative of more recent exposure too, or a fecal metal test, which is going to be more, I think, of screening test. That's how I use it, as a screening test for environmental exposure. The porphyrin profile does give some indication of the potential for cellular metabolic problems that might be occurring from the presence of heavy metals in the body. Now, I don't have a sample of one here. I had difficulty loading some PDF files to make them into slides. But what I often do in my practice, when I do an initial heavy metal screen, is I will do a hair analysis and a porphyrin analysis. Porphyrin is a urine test. And I look at both of them because the porphyrin test gives an indication of metabolic problems occurring at the cellular level through the mitochondria. The mitochondria are these little energy factories, and one of the things they do is they help in the production of heme. That's what the porphyrin pathway is all about. Okay, so we're making heme. Well, heme is necessary for hemoglobin to help carry oxygen in the blood. Heme is also needed in the detoxification system in the liver, particularly one called the P450 system, which is critically important. And heme also, interestingly enough, is involved in beta amyloid removal from the brain. Beta amyloids are something often seen in individuals with Alzheimer's disease. So it turns out that if the porphyrin test is positive, meaning that if one of those porphyrin markers, and it's a chain reaction, so you've got about, I think, 6 or 7 different porphyrin markers in this sequence of events, and if you got a few of them off, it definitely indicates that there's likely some toxic effect occurring from the presence of heavy metals, whether that's lead, arsenic, mercury, etc. So I'll often use the porphyrin test to get an idea of what I call the toxic index of heavy metals at the cellular level. Now, if the porphyrin test is normal, that doesn't mean that heavy metals may not be an issue, because you clearly can see levels on a hair test of mineral imbalances as well as levels of exposure. So it just, for me anyway, helps to differentiate between severe or quite significant cellular toxicity effects occurring from heavy metals and versus we've got heavy metals in the body that may not necessarily be causing a mitochondrial problem. either way, many times you're going to move forward with therapy to see if you get clinical improvement. So the bottom line to this particular section is obtaining absolute levels of heavy metals in the body is difficult. You're not going to get an absolute level of heavy metals based off of a hair test, a urine test, a stool test, or a blood test, or even a porphyrin test. You can get an idea of exposure, you can get an idea of what's coming out of the body, but you don't have an absolute value of how much is being stored. Now, there are some X-ray analysis tests that are helpful for lead to show, the absolute levels of lead stored in bones, but they don't have that available for other heavy metals. And the reality is it's not a practical test that's available for most people. So the bottom line really is that you're getting an idea about the presence of heavy metals, but not an absolute total value, and then correlating that with your particular child's situation. These are a couple hair tests of some individuals out of Asia. One is from a 4-year-old child out of Hong Kong, and another is from a child out of China. And I had mentioned earlier that I was going to show you some things with respects to arsenic. Now, the one here where it shows this child out of Hong Kong showing the arsenic levels really, really high. This particular one with respects to China, in 95% of the cases that I have been working with over the past year or so, the arsenic levels are mirror images of what we see in Hong Kong. This just happened to be one where I pulled up because I wanted to show there can be high levels of lead, mercury as well. So arsenic out of this particular group of individuals out of that part of the world are always extremely high. And one of the reasons is we know that arsenic is many times found in rice. It can be found in chicken. It can be found as an herbicide and a pesticide. And because, from a cultural food, those are often eaten in high amounts. So what I've noticed is a trend with over the years with individuals that I work with throughout the world is I clearly see high levels of almost all metals, I shouldn't say all, of the really toxic metals, arsenic, lead, mercury, out of Asia, arsenic probably being the highest. In South America, I actually see more lead levels that are high. Lead tends to be very high of kids out of South America, and that almost is a mirror image of what I see out of the Middle East. So when I get a hair test back on a child out of the Middle East, or even North Africa, there tends to be high levels of lead. Excluding Dubai. The Dubai region doesn't appear to really have high levels of lead. From my understanding, they're not using leaded gasoline. I've seen, interestingly, hair test out of Eastern Europe that is often very high in uranium. I've also seen uranium levels very high in kids out of Southern California. I haven't seen uranium levels that high in other places throughout the U.S. In California, I tend to see in the middle section of California, the San Joaquin Valley, a lot of the kids will tend to have high levels of arsenic because of all the farming communities. And then, of course, there's smattering of different metals throughout different parts of the country. So you can start to get an idea of a patient population, what metals they're going to tend to show up on the hair test. Now, if we think of metals, this was actually back in 2004 with respects to arsenic. And there's been a number of different governmental research that have actually found that the amount of arsenic in chicken actually greatly exceeds the EPA's new, the upper safety limit of arsenic for drinking water. So if you consume a lot of chicken that has been fed arsenic compounds, there's a good source of arsenic exposure coming from that. Now, back in, and things have changed. I mean, this was in 2004, but you kind of get the point. At that time, what they commented is that a bucket of Kentucky Fried Chicken would be expected to have almost 50 times the amount of arsenic allowed in a glass of water. So there wasn't a lot of regulation going on at that time. with respect to arsenic, but very much so with respect to water. One of the reasons is that the poultry industry is feeding, or particularly in the U.S. as it was, and that's been improved somewhat, feeding chickens feed that has arsenic in it. And one of them is to help fatten them up. And whether this is going on in some other places in the world, it probably is. And then, from 1992, another research article with respect to arsenic is just the understanding that arsenic is really a human carcinogen, not for a wide variety of different cancers, lung, liver, bladder, etc. And it also can create a lot of neurological and gastrointestinal problems as well. All right, so we talked about the defining metal toxicity, which can be challenging somewhat. There's not one particular test, so it's really a series of tests, and then applying that clinically to the individual. Well, what about provocative testing, and what is provocative testing? Provocative testing is also called challenge testing, and this is where you take a specific medication, such as DMPS or DMSA, and you give it in a high dose, and then you collect urine over a 6 to 8 hour period of time to see how much the body is spilling. And it can be useful, and for many years it's actually been considered a standard for assessing the total body burden to heavy metals. The one thing that I have found in my clinical practice, though, is that about 20% of the patients, whether they're adults, teenagers, or kids, on doing the provocative or challenge testing, whether it was IV or oral, more so oral than IV, but in general, don't tend to show a significant amount of metal excretion on a challenge test. Now, that doesn't mean that they don't benefit in many cases by therapy. It's just that initial test sometimes doesn't show high levels of metals coming out. And that could be because, honestly, they're poor detoxifiers. They could be holding on to those metals pretty aggressively. So the question is do you absolutely need to do provocative or what's called challenge testing in order to initiate heavy metal detox? And in my experience anymore, the answer is no. What I've often done, and because I work with so many kids, is do the hair testing, do the porphyrin testing, in many cases initiate therapy to see what kind of improvement we can get, and then trying to recheck a hair test every 3 to 4 months to see if the levels are dropping. So it doesn't mean that doing a challenge test is wrong. What I would always recommend, though, if a doctor is going to be doing a challenge test, that they first obtain a baseline urine initially. And the way I used to do it is, if we're going to do a challenge test, is collect, let's say you collect the first morning urine, ideally if it's a child, or you have somebody collect at least 6 hours of urine without any chelator, without any challenge agent. They then take the agent and then collect another 6 hours. So we've got a 6-hour collection prior as a baseline and a 6-hour collection post-administration of that chelator to compare the results. And oftentimes when you do that, whether it's oral or IV, you will see many times high levels of heavy metals. Nothing necessarily in the initial, or what's called the pre-provocative test, and in the post-provocative test oftentimes comes to that quite high. This is just one example for my practice, way back in 2006, where we did an oral challenge of DMPS. In general, DMPS is going to be more specific for mercury versus DMSA, but that's not, I don't want to indicate that there's necessarily one versus the other. That's sort of a general tendency. And whereas DMSA is going to have a little bit more of a robust effect against removing lead, but DMSA does a good job with mercury detox over time as well. So we'll talk a little bit about what are some of the differences or choices you might make with respect to the two. Well, what about natural agents? Sometimes I get asked, is it worth doing a challenge test for natural agents? whether you're using chlorella or using a transdermal cream or homeopathic sprays or cilantro, whatever it may be. In my experience, I've never seen a significant excretion of heavy metals compared from a pre-test to a post-test doing a challenge dose of natural remedies in comparison to what you get when you use the medications of DMSA or DMPS. That's not to say that some of these natural agents don't have an effect on removing heavy metals from the body long term. It's just doing a challenge test for the most part, at least in my experience, is going to be a waste of money. Well, what are some different options for heavy metal detox? There's a wide variety. You can do oral, transdermal, intravenous, and suppository. We'll talk about some of the differences coming up here. You can do a combination of some of these things. And then there's always that question of provocative testing versus just starting therapy. And in my practice anymore, for the most part, if we're going to do heavy metal detox, I'm more apt to just start therapy. So I used to do a lot of IVs, used to do high-dose orals, and a lot of times anymore, I'll just initiate therapy based on my initial testing and clinical suspicion. All right, let's talk about some traditional remedies here with respects to heavy metal detox. DMPS and DMSA, both of these are available from a prescription or via a prescription from a compounding pharmacy. DMPS as a compounded remedy is usually going to be more expensive than DMSA. DMSA here in the U.S. is available as a medication that you can get from most regular pharmacies via a prescription. It's called Kemet. It's a 100 milligram capsule. But if I'm going to use it, I'm most likely going to get it from a compounding pharmacy. There are some sites online that are selling DMSA as a supplement. So that still does exist. So in some cases, individuals can initiate or obtain DMSA just online as a supplement. I don't recommend that people move forward and attempt to do heavy metal detox on their own, but I just need to let you aware that there are some supplement companies out there that still make that option available. All right. Well, DMPS has been around for a long, long time. It's not in the U.S. anyway. It's not what's called a Food and Drug Administration approved medication in the U.S. That doesn't mean it's illegal, and that doesn't mean you can't use it. It just is listed from the FDA as what's called a bulk chemical that may be used in pharmacy compounding. So you can't go and just get DMPS from a regular pharmacy. It has to be obtained from a compounding pharmacy, a pharmacy that has taken the steps to obtain it on their own and then provide it to the public via a prescription. And it's effective against a wide variety of metals, mercury, arsenic, lead. It does remove some cadmium, although that EDTA as a detoxifier is likely better for that choice. And you're not dosing it necessarily as high as DMSA, and there's a lot of variety of ways of doing it. When I use DMPS, usually you're dosing it about every 8 hours with a 3-day on and 11-day off cycle. Initially, I usually when I do this, I'll initiate it for at least a couple months to see how somebody's doing, and maybe from there we might increase it to every 3 days on, 4 days off. In general, DMPS has a better absorption rate than DMSA. DMPS gets absorbed 40, 45, 50% compared to DMSA. So there's less potential for yeast aggravation in the digestive tract with DMPS, but as you'll see when we use low-dose DMSA, that issue has been reduced quite significantly. Now, DMSA has been around a long time here in the U.S. It is FDA approved for lead removal in kids. And again, I mentioned that the common medication via prescription from a regular pharmacy is called Kemet. And even the physician's desk reference, this huge reference book, that doctors will use to look up medication, they actually have a protocol for lead poisoning. Now, granted, this protocol is really more for acute lead poisoning, and they don't really take into account chronic lead exposure over time, but it's interesting that it's there, so the information does exist in the traditional medical world. Now, many years ago, within the biomedical community, and at that time, these Defeat Autism Now conferences, which were occurring throughout the country, had a protocol that was using DMSA for a wide variety of kids on the spectrum who had documented high levels of heavy metals. Now, this was an older protocol example. This really isn't done too much anymore. And at that time, we were dosing DMSA, usually at 10 milligrams per kilogram per dose, sometimes upwards of about 30. I, over time, started to kind of split the middle and do a 20 milligram per kilogram dose and dosed it every 8 hours as a 3-day on and 11-day off cycle. And that could be, so basically you're doing it every other weekend. And that would go on for many, many months. And, in many kids, it tended to work pretty well. The problem was there was more kids that got a lot of digestive problems from it. Because DMSA can stimulate yeast for sensitive individuals, the high-dose DMSA here was a problem for that. And so you'd end up running into a situation where you just couldn't continue at those dosages because kids were just getting too yeasty. And so a lot of this was abandoned many years ago. So what's happened, over the past number of years is not to give up on DMSA, but just to say, hey, it works, it's effective, it's generally easy to obtain and easy to give, but we probably just need to use lower amounts and tend to be giving it more frequently. An example of this now that has been what's called the AC protocol, or an individual by the name of Dr. Cutler, who's been at this research now for quite some time, and talking about the fact is really what needs to happen is give a much lower dose of DMSA at a much frequent dosing to improve its biochemical and metabolic efficiency in the body for more consistent removal of heavy metals out of the body, and to try to prevent too much redistribution of a metal to other tissues in the body. And this protocol has actually worked, really pretty well. And there's variations in dosing, and every individual and every child is going to be a little bit different in their response. But on average, in general, the dosings I list here are pretty conservative, and you're really giving it about every 4 hours. And initially, what I do is start off with a 3-day on and 11-day off cycle for a first few months to see how an individual will respond. And then once we've got a good track record, we can then increase the frequency. And I will usually go from every 3 days on, 11 days off, to eventually going 3 days on and 4 days off. So, and again, you're doing it, real low conservative dosages. I mean, if you figure, we're taking now, 0.625 to 1.25 milligrams on average per kilogram compared to what we were doing before, which was 20 milligrams per kilogram. I mean, the dosage ranges were huge before, much more conservative now. The nice thing about this is the kids tolerate it so much better. I don't see the digestive problems. I don't see the yeast issues. I don't see the side effects we used to get of hypersensitivity and the whole yeast side effects. It's just tolerated to a much better degree. And in my experience, the program works, because to me, heavy metal detox isn't something that you implement just for a few short weeks and say, I don't think it's working. It's something that is implemented over time. And that over time can mean many, many months. It could be 6 months, 9 months, a year or more. So as a parent, you've got to be patient with this. As a practitioner, you also need to be patient. understanding this is going to be something that you implement for many different kinds of patients for an extended period of time. The other nice thing with the low-dose program is you don't get the demineralization effects that we used to get with the high-dose programs. And that basically means causing mineral imbalances. Now, that doesn't happen to a significant degree anyway, because by the time you get to this point of doing metal detox, you should be working on improving diet. You should be analyzing the digestive system for yeast and bacteria and parasites and inflammation. You should be implementing supplement therapy of minerals and vitamins, etc. So you're not really even in a place or the potential place of causing mineral imbalances. So that's all been diminished because you're doing your foundational work first. So the low-dose DMSA program, from my standpoint, is effective, is a worthwhile pursuit for many individuals and for parents to look into and for practitioners to also investigate. And it tends to be the sole, not the only thing, but one of the main ways that I approach metal detoxification anymore for a vast number of patients. Okay, and so the bottom line to this is take your time. There's no need to rush, and pushing with higher dosages for most individuals is just really not warranted. All right, so let's transition and just talk about some testing options in addition to what I've already mentioned. Okay, so we talked about hair testing for chronic exposure. Urine testing is really most relevant for challenge testing. Mineral testing is also useful if you do the essential elements section, because that can be useful as a way to see if a patient or a child is very low in minerals too. So that does have some relevance with respect to overall nutritional effectiveness. The fecal metals is not something that I typically use on an ongoing basis to track metal excretion. Fecal metals are very good for current exposure. And then blood testing can be useful too for current exposure as well. Before we initiate detox therapy, if possible, it's worthwhile to do some baseline testing, some blood testing, looking at liver function, looking at kidney function, looking at complete blood counts, looking at iron levels, and trying to follow those every couple months. That's not always achievable with some kids. And honestly, with the low-dose programs anymore, from what I've seen in repeat blood testing, I don't see the mineral problems. I don't see the kidney problems or the liver issues. Not that I ever did even before with the other ways, with intravenous or high programs. But it doesn't come up very often that blood abnormalities are a big issue. And again, as I mentioned here, the urine testing and the porphyrin test. If you do the porphyrin analysis and it's positive, it's worth checking that about every 4 to 6 months. Let's say you were doing hair testing and porphyrin testing. I'd probably do the hair test about every 3, and probably the porphyrin test, maybe every 4 to 6. I mean, it wouldn't be a problem to do each every 4 months too, but the porphyrin analysis, if it was positive initially, is worth rechecking. And then one other thing here that I highly recommend that parents do, and practitioners if you're listening, is to do the organic acid test initially from Great Plains, and then checking that about every 6 months or so while you're doing detox therapy, just to look at metabolic markers, yeast levels, and bacterial levels. Okay, so we talked about DMPS and DMSA. What about calcium EDTA? Now, calcium EDTA has been around for many years, dating all the way back to the 40s, for lead toxicity. It's been used, for quite a long time as an intravenous therapy. It's also available as suppository and oral. And it's very effective for lead, as well as mercury, but probably more so lead. And it's probably one of the better things to use for cadmium exposure. The oral form as a powder in capsules or free powder is not so great overall. You may get some absorption, and so the benefit of taking it orally like that long term is you're going to get a percentage increase over time. but it's fairly, poorly absorbed at any given time. And there is a suppository option for calcium EDTA. Now here in the U.S., a number of years ago, there was a suppository product that you could obtain without a prescription called Detoxification. That was eventually discontinued by the FDA. But there is an alternative to it called Detox. It's essentially the same milligrams of calcium EDTA in a cocoa butter base, and that is available in some countries, and so that is an option. The benefit of the suppository is that you're bypassing the liver, and you're also bypassing the larger aspect of the intestinal tract for absorption. And when you do a suppository, essentially you're getting absorption right from the rectal mucosa, which is a very vascular area. Now, many of the compounding pharmacies can make calcium EDTA suppositories at different strengths, so that's always an option. The downside to suppositories is just that, is doing a suppository. For many kids, they don't want a suppository. There's not a lot of adults that want to do a suppository either. So it's the compliance factor of the suppositories that can be a challenge. Now in the past, and I've done quite a bit of this over the years, many times I'll incorporate a variety of different metal detoxifiers, EDTA, transitioning either with DMPS or DMSA to kind of try and enhance our detoxification effect. You can do calcium EDTA. You could do the same thing with DMSA or DMPS through a challenge test. Essentially, if you're going to do a challenge test with a suppository, what I recommend, whereas something like DMSA and DMPS orally or IV, you collect urine for about 6 hours, I'd probably collect urine for about 8 hours if I was doing a suppository, just because it can take a little while for that suppository to fully dissolve and for the medicine to be absorbed in the body. And then I had created a suppository program a number of years ago as a way, I think, to just see if we could maybe enhance the overall effectiveness. And, it was something I did with a few kids. Again, the challenge with the kids was doing the suppository. This would be something that would be more appropriate for an adult who can self-administer these suppositories on their own. And this was just an example that we did where you do DMPS, take a break, EDTA, take a break, go back to DMPS, and essentially you're rotating every other day with one of these chelators. And then if you do work with a compounding pharmacy, if you're a practitioner listening and you want to do suppositories, you can always have the compounding pharmacy add a little bit of glutathione to it, because we know that glutathione has an additive effect with respect to cellular detox. Okay, let's talk about intravenous detoxification. Well, it turns out that intravenous therapy or IV therapy for heavy metal detox is really the most direct way of giving it. It bypasses the gut and it bypasses the liver. It makes sense. You're putting the medication right into the bloodstream through a needle. So you're not getting any diminishment of absorption or depending on the digestive system to absorb all this for you. And oftentimes in doing IV, it can be infused with glutathione and or vitamin C, in many cases for added benefit. The IVs, it varies depending on the patient population and how aggressive you want to be. It can be done weekly, bi-weekly, monthly. For me, it was really the tolerance of the individual. For most of the kids, when we did IV, I would initially give just maybe, let's say, a glutathione. I wanted to see how a child would respond just to glutathione. And then have them, parents come back and report back over the next 72 hours or so. And then if they seem to do okay, have them come in the following week. And then we initiate the glutathione plus the other chelators, whether it was DMPS and or calcium EDTA. Remember I said calcium EDTA, not sodium or magnesium EDTA. It's the calcium EDTA that we would use in these circumstances. And then again, if you're doing a challenge, so you collect your a pre-urine test for at least 6 hours or so, and then you collect 6 hours worth of urine after the challenge is administered. Typically with EDTA, if EDTA was being used, I'd have people collect urine for a little bit longer, maybe about 8 hours. So, on average, between 6 to 8 hours, honestly, turned out to be pretty consistent with the results that we saw. Now, this is just, these two slides here coming up are just an example of dosages that can be used with respects to glutathione, EDTA, and DMPS. And typically what's done is you start with an IV, what's called an IV push of glutathione. That means it's pushed or infused over about a 3 to 5 minute period of time for any particular patient. And then you follow up with a second IV of calcium EDTA that maybe is infused a little bit more slowly, but again, it could be anywhere between 5 to 7 to 10 minutes. It's different if you're dealing with an adult where they've got a needle in their arm and they can be relaxing in a chair, watching TV or reading a book, or you're having a conversation, versus you've got a child that you're trying to do this on who's anxious, afraid, agitated. Sometimes you have to kind of speed things up for the kids, depending on their tolerance level. And then, of course, finishing up with the DMPS. Now, in my experience, I think a lot of individuals, when you're doing IV, when you're looking at these particular chelators, particularly the kids on a spectrum, oftentimes I think they got just benefit from the IV glutathione. And in fact, I still think that glutathione IV is really the most preferred way of administering that, because you bypass the liver, you bypass the gut, you're not dependent on another absorptive surface in the body to get it into the bloodstream. You're depositing it directly into the bloodstream, and it tends to have almost immediate effects for kids. That can be seen sometimes within hours and last many times for days, sometimes a week or more, many times with respect to language, comprehension, eye contact, etc. So I think the IV glutathione is great. The downside is it's not accessible to everybody. Not everybody does it, and so it's just not available. And so many times you have to use something either like transdermal glutathione or the liposomal, what's also called lipoceutical glutathione, to get that benefit. But if I had my way and it was possible to do it, I still really think the IV glutathione is a very good therapy. What about alternative options for detox? One of the things that I've used, and I do a lot of work with individuals overseas and who don't necessarily have a lot of access to either doctors who can administer these therapies or a lot of financial resources to continue with some of these therapies. This is one particular remedy that I really like. It's called Biocool. It's low-dose calcium EDTA in a very absorbable liquid form. It's got some electrolytes and sodium bicarbonate, which causes an alkalinity effect. And alkalinity is important specifically for cadmium detoxification. And it can be administered on a daily basis. The general starting dose is about 3 drops 3 times per day, and then you kind of work it up after a week or so to 5 drops 3 times per day. You can look at New Beginnings Nutritional's website here off that web address that I have. The dosages are listed there. But again, that's all dependent on tolerance, and the dosage can be adjusted. But that's a pretty good starting point for most kids. And of course, they're on other supplements, minerals and vitamins, etc. And what you'll often see is a diminishment in heavy metals over time off the hair test or another test that you may have done. Again, you got to be patient, and it's low dose, just like the low dose DMSA. This is low dose calcium EDTA. I've also incorporated this along with the DMSA low dose. I don't start both the same day. I would usually run one of these for a month or more before adding in something else, but sometimes that additive effect can be beneficial too. And then, of course, there are on the market as many options for heavy metals as there are opinions for heavy metal detox. And, you know, I've gone through a number of these over the years. I've looked at things like the NDF and zeolite and the clay baths and, you know, cilantro, homeopathic sprays, you name it. And I've seen benefit from the vast majority, and I've also seen, you know, nothing happen from a wide variety of these. I can't give an absolute indicator of one natural remedy is better than the other. There are other doctors out there who use things like chlorella and cilantro almost exclusively. So, you know, and you know, I know it can work. So a lot of it is depending on what you have access to. So I'm not against natural remedies. Some of them are quite expensive. You oftentimes don't get the mineral problems or the yeast problems from some of these that you might get with traditional chelators that are used at high dosages. So they certainly can be helpful. I do have to say, for a lot of the kids who can do baths, I have seen some beneficial things with some of the bath salts. And there are a number of different websites out there that carry bath salts. And I don't know if it's pulling out metals. Maybe what it's doing is it's helping to detox chemicals that we're exposed to. I mean, the reality is it's difficult to know because there's not absolute tests to confirm everything. But, you know, the bath salt therapies seem to help some kids. It's not an immediate thing. It's something that maybe transpires over a couple months. So I'm certainly not opposed to it. But again, people often ask me, what do I think about such and such versus DMSA or NDF versus DMPS? Vast majority of my experience has been in using the traditional therapies because they work. And it's not to say that these don't. It's just that you oftentimes don't get the same consistent effect that you might, and they can be very costly. So I can say I haven't seen any toxic or organ system problems or really any damage being done by using some of the natural remedies. So, you know, at that, I think it's, you know, they can be used, but it's more of just sort of an overall perspective. What about supportive therapy? Well, I talked about glutathione from an IV standpoint, and glutathione is good also in this liposomal form. I don't use oral glutathione in a capsule as a powder. It's just not absorbed to any significant degree, and with the yeast sensitivity issues that kids have, it's generally going to aggravate digestive yeast. And the bottom line is it just doesn't get absorbed either. So, but the lipoceutical glutathione is pretty good, and you take it. You can take it on the dosing ranges. What did I list here? Quarter teaspoon for every 30 pounds body weight. Yeah, that's a pretty good starting dose. I've gone higher, but you know, for a webinar presentation as a general statement, that's a pretty good place to start for most kids. Adults can go a little bit higher on that. The only thing about the lipoceutical glutathione is it smells pretty sulfury. It smells a little like rotten eggs. So it has a smell component to it that you need to be aware about. Also, one little trick with the lipoceutical glutathione is you can add a little stevia to it. Stevia is a natural sweetener you can get from a health food store. So if you're using a teaspoon, maybe a drop, no more than 2, usually in the lipoceutical glutathione will give it a little bit of a sweet taste that kids will like. Epsom salt creams also, you know, helpful for detox as well. So I tend to use more of the lipoceutical glutathione, but again, supportive therapy. Let's see if this thing's going to shift. Liver support's always a good idea, and there's a couple examples here from New Beginnings. There are other companies that carry liver support. Milk thistle, pretty common. You know, that's something that's often used to just support and protect the liver against toxicity. This liver essence product is nice. It contains a little bit of lipoic acid and NAC. I've not seen it be a big problem with respects to yeast issues. So, you know, just something to keep in mind. Artichoke extract is nice because artichoke extract actually helps with the detoxification flow through the kidney as opposed to just blocking stuff from accessing the kidney. But, you know, if you have any questions about that, or if there's any concern at all about lipoic or NAC for your child, then I would just lean on the milk thistle. Zinc is always important. So many kids are deficient in zinc. So many people are often deficient in zinc. It's a good idea to have some zinc supplementation in, you know, on average. The liquid zinc is convenient because you can throw it in a little bit of dilute juice for kids. You're not always having to rely on capsules. I mean, honestly, the most ideal way of checking these levels is to do blood testing, where you do a vitamin and mineral analysis. That's not always available. So typically for most kids, you know, anywhere 4, 5, 6, 7, 8 years of age, I'd probably be looking to use anywhere between 5 to 10 drops of the zinc sulfate a day, in addition to, you know, other multivitamin, multi-mineral products that we have kids on. And then, of course, minerals are really important. This particular product from New Beginnings has been great. A lot of people haven't misinterpreted this when it says chelate mate. They think that they're actually taking a chelating agent to detox heavy metals. And, you know, it's a little bit of a play on words. You know, you could say it's a mate, like, hey, mate, you know, so it's a chelate mate or a chelate friend if you're doing heavy metal detox, you know, i.e. chelation therapy. But also, you can also look at things from a standpoint of just chelated minerals, which means they're bound in a certain way. But anyway, these are very absorbable form of ionized minerals, very good absorption, and it works really, really well. The one thing with respects to the chelate mate, particularly for little kids, is a bit salty tasting, so it's best mixed in some dilute juice. You can mix it in soup or stew, but if you go to New Beginnings website and you go under chelate mate, they'll give you some recommendations on what to take it with. So with that, you know, we know it's important to have individuals, whether they're kids or not, on supportive therapy. So let's just kind of wrap up here. What are some final thoughts? Intravenous therapy, IV therapy, is going to be your most direct way of doing heavy metal detox. It's not always available. It's not always practical. So it's an option, but it's not one that's, I think, the thing that's most commonly available for most people. Oral is readily available and generally easier to use and easier to do than the IV. And honestly, anymore, this is my preferred way of doing it, particularly with the low-dose forms of DMSA. Suppository, I think suppository is an option for kids. It's just not user-friendly. So that's the only major downside to it. And, you know, when you look at the absorption and the blood level consistency effects of things like the DMSA, you know, doing suppository, you're just going to get inconsistent levels of these chelators. And, you know, unless you're going to be sitting there doing low-dose suppositories every 4 hours, I don't know anybody that's going to volunteer to do that. And then finally, transdermal. Transdermals were the hot thing for many, many years, the transdermal DMPS. I know I did it for a number of years, and at the end of that time, I could honestly sort of walk away and say, you know, some kids got benefit. I'm not quite sure it was really all that helpful. Maybe it was an absorption thing. Maybe we didn't do it long enough. I don't know. But it's not something that I gravitate towards too much anymore. I don't take it off my list, primarily because it still needs to be on the list of things to do if you can't do suppositories, you can't do oral, and you can't do IV. I mean, if that's the only option you have, then transdermal DMSA or DMPS is an option, but it's way down the list as far as I'm concerned. All right. So with that, I hope that information was useful to you. Obviously, we could, like all of these webinars, we could go on and on and on and talk about for hours. I wanted to make you aware of a new service that we have created and a new website called Lab Test Plus. And this is a website where you as the consumer, whether it's for yourself or your family, wanting to access various tests, some tests from Great Plains specifically, whether it's heavy metal testing, whether you're looking at organic acid testing for yeast and bacteria, comprehensive digestive stool analysis, even adrenal, salivary, and hormone testing, for adults who want to look at adrenal exhaustion patterns or for their kids as well. We have these tests available through Lab Test Plus. When you order a test, the tests are sent to your home or office. There's no doctor visit that's needed for ordering. Each lab test is personally reviewed by an integrative medicine doctor, including myself. And you also, with the lab test, will get a specialized written lab review with what we call recommended action steps based on the lab test markers. And these could include, a recommendation protocol for a specific intervention. It might recommend, hey, in this particular situation, a medication is needed that you could then go back and discuss with your primary care doctor, or a list of various supplements and how to obtain those supplements from a wide variety of professional line companies. So it's a great service, and it now allows people to really take charge of their own personal health and to really incorporate information with respect to themselves and their family. So you can get more information on what tests are available at labtestplus.com, and you can go into the testing section and see a complete list of what's available. So with that, I appreciate everybody joining me tonight, and I just want to give you a quick heads up that I'm always available for ongoing questions and answers through Autism Action Plan. Autism Action Plan is a subscription website where you basically just pay on a month-to-month basis. You can quit anytime. There's no long-term contracts. Whether you're working with a doctor or not, trying to do things on your own, you want to troubleshoot, you want to ask a second opinion, you want to show me a link to a research article or have questions about supplements, whatever it may be, Autism Action Plan is a great place to go. There's a very interactive parent forum, and you can also post me questions privately as well. So I answer questions throughout the day. I answer questions on the weekends and even holidays. So I'm accessible on this website, over a 24-hour period of time on an ongoing basis. And then, of course, I'm always available for private consultations through my private practice. My general website is drwohler.com. There's a link to my office information, and then you can always contact my practice manager at that phone number there, or at info@mysunrisecenter.com for more information on my private practice. And I do in-person, phone, and Skype consultations for people throughout the country and around the world. So I do a lot of health consulting through my private practice. So I appreciate everybody joining me tonight. We will be back again in a month with another webinar hosted by Great Plains, and we will see you then. Everybody take care. Thanks.